The mic. Is this one? But this one seems to be on. I don't think this is on. I think it's this one. Oh,
You just speak.
oh, it's these two. Right. No, not the big one. Not the big one. Okay. You can hear me. Okay. Nobody complains usually about not being able to hear me. Usually they say tone it down. Anyway, good morning, everybody. My name is Giselle Stolper. I'm the President and CEO of MHA-NYC, and welcome to the third annual Michael B. Friedman Policy Lecture. It really is wonderful that you're all here this morning, and this time we're ahead of the bad weather, as opposed to chasing. Oh, okay, thank you. Chasing or running from the storm. So I guess it's good luck now, Michael, as opposed to bad omen with Hurricane Sandy, and kind of not great times, a few months for everybody, especially people here in this building. The building was underwater for a while, and people just got back in January. So it's all but good things ahead for everybody. So thank you for joining us. We know this is going to be an extremely informative and engaging discussion on the substantial changes occurring in behavioral health care, and to honor a distinguished leader in the field, David Mechanic. David has made contributions, many contributions actually, over the years toward advancing our understanding of mental health care policy in the United States. I also, of course, want to recognize Michael Friedman. Michael, wake up. Really, I think that many people are here today, not just because of the lecture, which is an important lecture, but to come and to see you and to show how happy we are to see you again, and that you were able to make it here today. It means much to all of us. Michael, of course, as you know, was an outstanding mental health advocate in New York State for over 40 years, and in retirement remains a certainly prolific writer, as many of us know in the room, as we get to read your many works most mornings. When I wake up, they're there waiting for me. I don't think the man ever sleeps, but Harriet, that's your problem, not ours. And not only writer, but Michael remains a respected thought leader here in New York State around mental health policy. Certainly we at MHA-NYC often consult him, and we're very grateful that he remains active in the field. I want to thank Emblem Health for hosting and underwriting a significant portion of this morning's meeting, and especially Denise Shearer, who's the events manager here at Emblem, for her support in coordinating the event. Denise is a friend of MHA's, now second year actually working with us in event planning. Also, I want to thank the many members of the planning committee for their assistance: Peter Weichman of the Bridge, Amy Doran of FEGS, Toby Wheeler, MHA board member, Irfan Hassan of the New York Community Trust, Ron Soloway of UGA Federation, Michael Friedman, of course, he wouldn't let us plan anything without being part of it, and Kimberly Williams, who's MHA's Center Director. In addition to our honoree and lecture respondents here today, I'd like to recognize a few distinguished partners from government and philanthropy and others here this morning. Lloyd Sederer, Medical Director of the New York State Office of Mental Health, Steve Rabinowitz, Director of Downstate Field Operations for the New York State Office of Alcoholism and Substance Abuse Services, Joyce Whale, Assistant Vice President, New York City Health and Hospitals Corporation, Lily Tom, Assistant Commissioner for the Bureau of Child, Youth, and Family Services at DOHMH, Myla Harrison, Medical Director for the Bureau of Child and Youth and Family Services for DOHMH, Sanjay Park, Counsel for New York Council Member Oliver Coppell's office, Irfan Hassan, Program Officer, New York Community Trust, Rachel Pine, Rachel, I know is here, the Program Officer of the Alton Foundation, and Robert Wolf, Deputy Executive Director of the Healthcare Chaplaincy. So thank you all for joining us today. MHA has a unique three-part mission of services, advocacy, and education. But our advocacy and our policy work really are at the core of our historic mission and our founding history. And that work is maintained, and actually I shouldn't just say maintained, but is really furthered by the work of the center under the visionary leadership of Kim Williams. And I want to thank Kim for all that she does. Kim had a really hard job. She had to follow in the footprint of Michael Friedman, and that's not an easy job to do. And not only has she done that, I hate to tell you, Michael, she's kind of all the way on the way to surpassing your wonderful leadership. And I'm sure you take pride in hearing me say that. But here we are today at an interesting time in history on many levels. I guess no more time more than now with federal health care reform at the national level and implementation of profound changes in New York State's Medicaid program is MHA's longstanding dedication to advancing policy reform on behalf of people with mental illness more needed, as is the dedicated advocacy of everyone in this room today. We're at a serious juncture, and we all know that, with New York State preparing to expand managed care for people with long-term psychiatric disabilities. Thoughtful, long-term strategic planning is really critical to the successful implementation of this new system of care. It's not, I could say, not that hard to just make change, to implement new systems, but to do it in thoughtful, planful ways, to have a system that continues to offer consumer and families timely, high-quality treatment, and the continuity of care that's necessary for optimal recovery and success in the community. And I guess I said to Eileen before, Eileen was at Margaret sitting up front, was at our office yesterday talking to our staff about managed care, and I thought to myself, you know, Eileen remained optimistic in her words. She talked about the positive opportunities for change. And I find it's very difficult, as I'm sure many of you feel, it's very difficult to maintain that level of optimism and hope for a system that we all know wasn't so great. It isn't so great. It's not so perfect to begin with. And we can only hope it's going to be better with some of the changes. But it's incumbent on all of us, it's incumbent on people at every level of government and the advocacy community to make sure that it doesn't just remain the same. We know it won't, but that in some ways it's better for people with mental illness and their families. But enough from me. Let's turn now to the real experts who are in the room today to enhance our understanding of the complex behavioral health policy reforms in the history, in the context of history, a historical perspective. And that's what David Mechanic is really known for. And that's being able to look at where we're going, but look at where we were. Because only by looking at our history can we really fully understand where we are today, why we're here today, and perhaps have a hopeful future to not make some of the same mistakes that we've made in the past going forward. So thank you again, and I'd like to now invite Kimberly Williams to introduce our keynote speaker.